video provides instructions for the 3M Bair Hugger Warming Unit Model 775 and is intended for clinicians only. The Bair Hugger Warming Unit Model 775 can be connected to all Bair Hugger warming blankets and gowns for clinical warming in the intra-op and post-op settings, where it can help prevent and treat hypothermia. The Bair Hugger system is contraindicated for use on patient lower extremities during aortic cross-clamping. Prior to use, consult detailed product indications, limitations, safety information, and instructions in the provided operator's manual and preventive maintenance manual. Additional safety information specific to the product is available at the end of the video. The 3M Bair Hugger Warming Unit Model 775 consists of a control panel with alphanumeric display, a carrying handle, power cord, warming hose, IV pole mount, and an optional rolling cart and cart handle. The 3M Bair Hugger Warming Unit Model 775 should be placed on a flat, hard, dry surface or mounted on an IV pole or rolling cart. To mount the warming unit to an IV pole, turn the clamp handle clockwise to tighten the clamp on the IV pole and counterclockwise to release. To prevent tipping, the distance from the bottom of the warming unit to the floor must be less than 44 inches, 112 centimeters, and the IV pole wheelbase must be at least 28 inches, 71 centimeters in diameter. Connect the warming unit power cord to a properly grounded power source. An automatic power on reset sequence will start, the standby button will illuminate amber, and the high fan speed will illuminate green to show that the unit has power. The unit has 3 temperature sensors, with 2 of these located at the end of the hose where it connects to the blanket to provide air temperature detection. Insert the end of the Bair Hugger warming unit hose into the Bair Hugger warming blanket or gown hose port using a twisting motion to ensure a snug fit. A marker around the midsection of the hose provides a guide as to how far the hose can be inserted into the blanket or gown. Insertion beyond this marker can result in the warming unit alarming and left uncorrected, can result in injury. Never treat patients with the warming hose alone. Be sure that the patient is not lying on the warming hose or does not have any direct skin contact with the hose. You should support the hose by attaching a tethered sheet clip to the OR bed or IV pole. To help provide a secure attachment, you can adjust the tether along the length of the hose. The 775 features 2 airflow settings, high and low. High airflow provides the most effective heat transfer for anesthetized patients. At any time, the fan speed setting can be changed by pressing the corresponding button. There are 4 temperature settings, high at 43 degrees Celsius, medium at 38 degrees Celsius, low at 32 degrees Celsius, and ambient air, enabling the delivery of effective forced air warming as required by each individual patient. Select your required temperature. This will turn the unit and heater on. When the unit reaches the selected temperature, the Temp in Range button will illuminate, and the display screen will show the temperature at the end of the Bair Hugger warming hose in degrees Celsius. Ambient air setting will blow room temperature air. Solventum recommends continuously monitoring core temperature. In the absence of continuous monitoring, monitor the temperature of patients who are incapable of reacting, communicating, and/or who cannot sense temperature a minimum of every 15 minutes or according to your institutional protocol. Discontinue warming therapy when the temperature goal has been achieved. To view the temperature mode timer, press the button and hold for 3 seconds for the current temperature mode. The display will show the temperature mode time, and then return to the temperature mode setting. If an overtemperature condition occurs, the red overtemp indicator light flashes and an audible alarm sounds. The warming unit automatically turns off the heater, blower, and the operating mode indicator lights. A fault code will appear in the display. Pressing any button will silence the alarm. Do not restart the unit. It should be unplugged and removed from use for service inspection by a qualified service technician. The Model 775 unit has 5 alternative modes that allow access to the service and calibration utilities of the unit. To access the alternative modes, press and hold the Bair Hugger logo in combination with one of the operating mode buttons located on the front panel. Each combination accesses a different service or calibration mode. Service technicians can reference instructions located in the preventative maintenance manual. Exit the alternative modes by pressing the Bair Hugger logo on the control panel or by waiting 60 seconds. When warming therapy is complete, press the standby button to return to standby mode. Unplug the warming unit from the power source once finished using the system. Remove and dispose of the single-use warming blanket or gown disposable per facility protocol. Once disconnected from the power source, perform cleaning in accordance with facility protocols. Use a damp, soft cloth and a hospital-approved mild detergent, germicidal disposable wipes, or antimicrobial spray. Consult the operator's manual for recommended cleaning solutions. Wipe the warming unit and the outside of the warming unit hose after every use. To check the filter usage time, press and hold the Bair Hugger logo for 3 seconds. The run timer will appear on the display showing the use in hours. If the counter is at or close to 500 hours, it is time for the filter to be changed. To exit the run timer, press the Bair Hugger logo or by waiting 60 seconds. When finished, the filter should be changed by service personnel. Do not attempt to replace the filter while the unit is still in use. The Bair Hugger Model 775 warming unit contains a MERV 14 rated filter. To keep your warming unit running at maximum efficiency, this filter should be changed every 12 months or after 500 operating hours. Disconnect the warming unit from the grounded power source. Do not attempt to clean the air filter as it may be contaminated from use. Discard the filter in a manner consistent with your facility protocol. Follow the instructions in the preventative maintenance manual to change the filter. As with any device, it is important to read and understand the detailed instructions for use and safety information, including information on the risk of thermal injury, altered drug delivery, interference with ventilation, patient falls, and hazardous voltage and fire. Applicable to the use of the 3M Bair Hugger Warming Unit Model 775, which can be found in the device operator's manual provided with the warming unit. The Bair Hugger warming system should only be used by trained medical professionals. If you have product questions, please contact your local Solventum representative. Call the Solventum customer care at 800-228-3957 or visit solventum.com. Solventum offers device training upon request.